Ladies and gentlemen, please welcome Professor Cato Laurencin, committee member of Prix Galien USA.
Thank you. Thank you. Well, thank you very much. Now, I know everyone is very excited and talking among yourselves, but if you can give me just a few minutes of your time, I would appreciate it. So it's a pleasure for me to present the first Prix Galien Prize. First, I've had the pleasure of coming here to the American Museum of Natural History for a number of years, and I've actually learned something every time I've been here. So I thought I'd start by sharing something I've learned. Each year, the museum organizes more than 100 research expeditions that visit destinations around the world. The tradition dates back to the late 19th century, and from 1880 to 1908, museum ambassadors explored the North Pole, Siberia, Outer Mongolia, and the Congo. And when I think about the Prix Galien, I think about the passion of the scientists who in many ways have been explorers, bringing new therapies to patients, but more than that, I want to make sure, and it was discussed a bit earlier, but I want to emphasize, that we celebrate the people who are the heroes and superheroes among us. Now, I think about this a little bit differently, so I'll give you my impressions. The heroes are the patients that we have the privilege to serve. Many are battling every day, but mostly quietly, illnesses and sickness that often can be quite severe and debilitating. And they are mothers, they are fathers, they are brothers and sisters, and friends, and also, as we know, colleagues. To me, our patients are heroes, and they take on life's problems every day. Our patients are heroes. But then who are the superheroes? I referred to heroes and superheroes. So last year, and I mentioned this before, but last year I was at a National Academy of Medicine workshop in Washington focusing on our new field of regenerative engineering. And all the talks were really excellent. But I was really struck by one of the presentations in the session that I chaired. Dr. Clyde Svensson is a professor at Cedars-Sinai, and he presented really exciting work on a clinical trial that he had using stem cells for the treatment of ALS. Now, for those that are unfamiliar, amyotrophic lateral sclerosis is also called Lou Gehrig's disease, and it caused the death of motor neurons that control voluntary movement. The weakness takes place everywhere, but it's the weakness of the diaphragm which makes it difficult for patients to breathe, and ultimately, they all succumb. So Dr. Svensson's clinical trial involves patient taking stem cells surgically and placing them in the lumbar spine to improve the lower limb motion. He and his team have a number of individuals with ALS who are enrolled. So remember, they're implanting it in the lumbar spine to see whether these stem cells can actually work in terms of regenerating neurons. So it means that these patients are enrolled knowing that the clinical trial will not help their longevity. They will succumb to respiratory failure. And so they have agreed to have their bodies autopsied after they die to help scientists learn more about how stem cells can affect neural regeneration in ALS. They are part of the trial, and they're really there to help others in the next generation with the disease in the years to come. That's a dramatic example, but I submit to you that these individuals No. And so I submit to you that these individuals and others who volunteer for clinical trials are the superheroes. And I know that while we are celebrating ourselves in many ways, it's of central importance tonight, and really indeed every night, that we do not forget them. Thank you. So now let's proceed with the nominees for our first category.
Best Medical Technology. Abbott, freestyle-free 14-day flash glucose monitoring system. A continuous glucose monitoring device indicated for the management of diabetes. Biotronic, PK papyrus-covered coronary stent. Treatment of acute perforations of native coronary arteries and coronary bypass grafts in vessels 2.5 to 5 millimeters in diameter. Boston Scientific Corporation, Axio stent and electrocautery enhanced delivery system. To facilitate transgastric or transduodenal endoscopic drainage of symptomatic pancreatic pseudocysts. Boston Scientific Corporation, HeartLogic heart failure diagnostic. Proactively predicts worsening of heart failure and alerts clinicians to changes in patient status. Boston Scientific Corporation, Sentinel Cerebral Protection System. To capture and remove thrombus and debris while performing transcatheter aortic valve replacement procedures. Clinical Research Consultants Incorporated and Human Optics AG, Custom Flex, Artificial Iris. Treatment of full or partial aniridia resulting from congenital aniridia, acquired defects, or other conditions associated with full or partial aniridia. Edwards Life Sciences Corporation, Inspiris Resilia aortic valve, replacement of native or prosthetic aortic heart valves. Endomag Limited, MagTrace and Centimag magnetic localization system. MagTrace assists in localizing lymph nodes draining a tumor site as part of a sentinel lymph node biopsy procedure in patients with breast cancer undergoing a mastectomy. Centimag guides surgeons to mark tissue for removal and subsequent pathological examination. Glaukos Corporation, iStent Inject, for use in conjunction with cataract surgery for the reduction of intraocular pressure in adults with primary open-angle glaucoma. Medtronic, implantable system for remodeling. Patients with class 1, 2, and 3 pulmonary arterial hypertension receiving intravenous delivery of remodeling. Medtronic brain modulation. Medtronic DBS therapy for epilepsy. Adjunctive therapy for reducing the frequency of seizures in adults 18 and up diagnosed with epilepsy. Pear Therapeutics, Reset and Reset-O. Reset, treatment for patients with substance use disorder to increase abstinence. Reset-O increases retention of patients with opioid use disorder as an adjunct to outpatient treatment. Pulmonx Corporation, Zephyr endobronchial valve system, bronchoscopic treatment of adult patients with hyperinflation associated with severe emphysema in regions of the lung that have little to no collateral ventilation. Sonendo, the gentle wave system, prepares, cleans, and irrigates teeth indicated for root canal therapy. Teva Pharmaceutical Industries, ProAir Digihaler, treatment or prevention of bronchospasm with reversible obstructive airway disease and prevention of exercise-induced bronchospasm in patients 4 and up.
Now let me just say that the committee, the selection committee, was really impressed with the nominations from this category. And it was actually a very, very hard decision in terms of making that happen. So we're going to, as 50 Cent once said, we're going to switch our style up a little bit on this. Some people get that. And we're actually going to have a medical student from the Vagelos Columbia School of Medicine come, and she's actually going to be bringing me the envelope with the winner, but also I'd like her to say a few words. This is Carrie Fultz from Columbia. Had an opportunity to talk to her. She's really exciting. She's doing exciting work. She is a fantastic student. She went to Carnegie Mellon, where she not only worked in neuroscience, but also in health policy. She's from New Jersey, and that's a good thing, right? Who's from New Jersey? And she's part of the future, so we thought we'd do things a little bit differently and maybe ask you to say a few words to us. Great.
Hi, everyone. Thank you for having me here tonight. So my name is Carrie Filtz, and I'm a second-year medical student at the Vagelos College of Physicians and Surgeons. Thank you, Dr. Vagelos. So I'll be starting my clinical rotations this January. I am excited to get out of the classroom and into the clinics. I am also absolutely terrified at not being able to live up to this immense responsibility. I talked to one of my mentors about these fears, and she gave me some reassuring advice. Those fears that you have are because you care. This is something that I know everyone in this room can relate to because we all care about the same thing: healing patients and saving lives. And through my terror, this has been a comfort to me, knowing that I am just a small part of this huge community of which you all are also a part, and that none of us are going this alone. I look forward to the future, and I hope that in my interactions with patients, I can do justice to the empathy and dedication that you all pour into your work every day. Thank you.
Well, I don't know about you, but I think this is remarkable that someone's speaking in front of literally thousands of people. So I want to give you another round of applause. You're the first student to be presenting today.